This is Mahmoud Kiyami from the Dean McGee Eye Institute, University of Oklahoma. We're going to look at iTrack ab-interno canaloplasty known as ABIC. First step is to create a paracentesis a couple of clock hours from the future otomy site. Viscoelastic is then placed into the anterior chamber to hyperpressurize the AC. And you can see me priming the iTrack catheter right now, and you can see how much OVD is expressed onto the cornea. The iTrack is then placed into the anterior chamber and then secured to the patient's forehead or close to the nasal bridge. The patient's head is also tilted away from me, and you can see that I'm tilting the scope towards me in typical angle-based surgery fashion. This allows us to get a good view of the angle, especially using a gonioprism that's floated over the cornea. 27 gauge half-inch needle is then used to slightly score over anterior trabecular meshwork, and you saw how I pulled down a little bit on TM to expose Schlemm's canal, and MST forceps are then used to guide the iTrack catheter into canal, either from the external approach or internal approach, as you see there. You can see the lit tip kind of coming around 360 degrees, letting you know where it's at all times. Here you can see that it's come all the way around 360 degrees. The lit tip again shows you where you're at. And it's
All
at
right,
this
I think
point
we're
that
getting
I
ready to go
will
here.
retract the catheter.
And
And as
let's
I begin to retract the
go.
catheter, I will
One,
then ask
two,
my
three,
scrub tech to start
four,
clicking on the
five,
viscoelastic
six,
injector. And you
seven,
can see
eight,
that clearly
nine,
there.
10, 11,
Every
12,
time there's
13,
1/8 of a
14,
revolution
15, 16,
on
17,
that
18, 19, 20,
viscoelastic
21,
injector,
2,
um,
3,
it
4,
will
5,
express
6, 7, 8,
viscoelastic into
29,
Schlemm's canal,
30, 31,
which is
32,
then forced
33,
anteriorly
34,
through
35,
TM and
36,
posteriorly
37,
through Schlemm's
38,
canal and
39,
into the collector
40,
channel.
41,
With
42,
one
43,
continuous smooth
44,
motion,
Excellent.
the iTrack catheter is retracted completely out, the patient's head is tilted back towards me, and the OVD that was placed into the anterior chamber is removed with the irrigation aspiration handpiece.